Hi, my name is Dr. Ryan Anderson. I'm a part of Utah Foot and Ankle Specialists. We are located in Bountiful, Utah, as well as Draper, Utah. And today I just wanted to spend some time to talk to you about this new procedure that we've been doing for this last year. It's called the FAST procedure by 10X Health. It's a new procedure and device that was developed in conjunction with the Mayo Clinic. Initially to treat cataracts, and now it's been developed for chronic tendon pain. So I wanted to describe a little bit today about what the indications are for this, what to expect when you get this procedure done, and why it's such a benefit over things that have been offered in the past. One of the most common things that we treat here in our office is plantar fasciitis, which is, some people know it as heel spur syndrome. Basically, when your arch gets overused or damaged, the ligament pulls and strains away from the heel bone where it attaches right here, and people over time can develop scar tissue that builds up in the ligament. You'll also on an x-ray oftentimes see a spur that develops, which is known as a heel spur, that can contribute to pain in active people. So a lot of times when people come in with this, we see that it's been a chronic thing where maybe they've had it for anywhere from 6 months to a year to several years. A lot of people that stand a lot suffer from this pain as well. Traditionally, the treatments have been obviously conservative care, which includes stretching, icing, arch supports, changes in shoe gear, cortisone injections, physical therapy. This helps the majority of people that have had it for a shorter period of time get better. We see a lot of people that have had this for more of a chronic time period and have exhausted all of these different treatments without success. And usually at this point in time, these people are starting to have pain on the outside of their ankle or outside of their foot because they've learned to walk differently because of the chronic pain. And so this is the type of person that comes in that's had this pain for at least 6 months that really benefits from a more invasive procedure. Now, traditionally, that procedure has been open surgery, which the downsides to open surgery is obviously it's a surgery that requires stitches. There's chances for infection, scar tissue buildup can occur, and it can change the dynamics of your arch by having to release that tendon on the heel. The new procedure, called the FAST procedure, is a great procedure because we're able to, through a minimally invasive entry site, go in, and it's designed. It's a wand. It's about the size of a toothpick, and we're able to go in and clean up, remove a lot of the damaged and scarred tissue without disrupting the surrounding healthy tissue. I wanted to show you today what the FAST wand looks like. It's attached to a tube and a device that it has some small little instruments at the tip of this needle that move at hypersonic speed, and basically it goes in and breaks up all the unhealthy tissue. We're doing this while we're visualizing this under ultrasound. So we're able to go in and remove all of the unhealthy tissue where the tendon or the ligament attaches to the bone. It's sucked out through this tube into a saline bag, and the whole time that we're doing this, we're visualizing it under ultrasound. I wanted to show you right here. This is a typical diagnostic ultrasound, and I took a picture of the bottom of my heel. This is the bottom of the heel and the tendon. You may not be able to see this in detail, but with this type of technology, we're able to watch the needle as it comes through the skin. And so while we're doing this procedure in the operating room, we're using the ultrasound, which is held against the bottom of the foot, and this guides the angle and the placement of the wand. This is done under local anesthetic, usually a light sedation, so the person that's having it done is either sedated or completely asleep, depending on their preference. And we're able to go in, and it takes about 10 minutes or so, clean up all the scar tissue and remove substantial portions of spur as well. The beauty of this procedure is we're seeing people right away that have huge reductions in pain. They're able to get back to activities really quickly. You're able to walk from day one. Usually we'll put somebody into a walking boot for anywhere from 7 to 10 days, and then typically somebody who wants to resume more aggressive activities like running are back doing it in about 4 weeks afterwards. Again, we're excited about this FAST procedure because, compared to traditional surgery and some of the other options, this is something that allows active people who have this chronic heel pain to have the scar tissue removed, which allows them to get back to activity without excessive pain. If you want extra information about this, obviously you can go to our website, which is bountifulfootdoctor.com. You can also go to 10xhealth.com, and there's a lot of information about this procedure as well. Thanks.